Hi, my name is Mahitha Penmetsa, and this is my friend Siri Dandu. We are from Downingtown East High School in Pennsylvania.
So a little about ourselves. For the past year, we have been researching one method of early detection for breast cancer called graphene biosensors with the use of mRNA 155. We compete in TSA and HOSA and enjoy dancing and running. In the future, we hope to focus on an intersection between computer science and medicine to develop accessible medical technologies. We are here today to talk about global breast cancer early detection and its challenges and promoters.
In 2020 alone, 2.3 million women were diagnosed with breast cancer, and around 685,000 women died, marking a 0.5% increase in the number of deaths resulting from breast cancer.
This map shows the most prevalent cancers in each country. Pink represents breast cancer. As of the end of 2020, breast cancer is one of the most prevalent cancers globally. Breast cancer is shown to have large effects in both developed and developing countries.
And when we're given these statistics, the first intervention that comes to mind is improving treatment methods. Yet, according to the World Health Organization, breast cancer treatment is already highly effective. They're achieving survival probabilities of 90% or even higher. So to maximize treatment efficiency and to improve survival rates, we need to detect breast cancer at its early developmental stages.
This graph represents data from women aged 15 to 99 in England, a more developed country. At stage 1, the survival rate nears around 100%, but as the breast cancer progresses, a dramatic decrease in the survival rate follows.
And when breast cancer is detected in its early stages, the cancer is still localized to the breast. There's a wider array of treatment options. The average 5-year survival rate of breast cancer detected before metastasis is around 98%, while even metastasis to just the lymph nodes decreases the survival rate to 84% due to greater difference in treatment. Thus, it is necessary to detect breast cancer at early stages.
Today, the most prominent method for breast cancer detection is mammography, but cost, comfortability, and accessibility can hinder individuals from receiving regular screenings. Furthermore, it is difficult to differentiate between fibrous tissue and cancerous tumors, resulting in false negative results. As you can see in the picture, in the dense breast, the fibrous tissue has similar features to cancerous tumors, making it difficult to locate the cancer. Affordable access to breast cancer detection in the public sector is also limited, especially in low-income and middle-income countries. The lack of integrated national screening activities and facilities result in the lack of early detection.
One study by researchers from Hanoi University of Public Health in Vietnam puts this scenario into perspective. The study found multiple breast cancer screening initiatives from a regional point of view, such as the We Care for Her campaign and Committee for Advancement of Women in Hanoi, but none were implemented through national jurisdiction. The researchers estimated that less than 10% of all eligible women receive appropriate annual breast screening. The screenings are often found to be central to urban locations and wealthier women, as screening activities are also not covered under national health insurance. This situation is a prime example of how national and economic barriers play a role in preventing breast cancer screening. The inconsistency can delay detection of breast cancer, making it more difficult to treat.
One other factor that plays a role in preventing early screening is stigmatization of breast cancer. Stigmatization stems from a lack of education about breast cancer and breast health. As with many cancers, the difficulties of diagnosis can deter many women from getting screened. When diagnosed, women are faced with feelings of fear and isolation. The likely reaction is to delay breast cancer screening as a result of such stigmatization, which can make it difficult to treat cancer when it's found at later stages.
The Research Triangle Institute analyzed recorded transcripts of conversations with women from Karnataka, India, regarding breast cancer. Some words that frequently appeared were concerning the family and community perceptions, difficulty to disclose the diagnosis, and fear of death and disability with the breast cancer diagnosis. Many of the women described that they were afraid of experiencing isolation and verbal judgment from others. This case study details specific feelings present within the female population in Karnataka, but these ideologies may apply to women of other cultures as well. To mitigate these feelings, we need to destigmatize breast cancer, hence being able to improve the rates of early detection.
Although there are many obstacles facing breast cancer early detection, many organizations are making it a priority to discuss breast cancer early detection and provide support for routine breast cancer screening. One example is the CDC's National Breast and Cervical Cancer Early Detection Program. This program provides low-income, uninsured, and underserved women access to timely breast cancer screening and diagnostic services in the United States. These initiatives can be replicated globally to make breast cancer screening more accessible and hence early detection viable.
Another organization that is taking steps towards making early detection viable is the Global Breast Cancer Initiative, created by the World Health Organization, which strategically strengthens healthcare access. Their first pillar, notably, focuses on early detection and health promotion. Some steps taken by the organization included providing education on basic breast health to reduce stigmas, and educating general healthcare providers about the signs and symptoms of early breast cancer presentation to facilitate the recognition of women with early stage breast cancers. Furthermore, systematic disorganization often results in complicated diagnostic services. Organizational efforts by the initiative, such as implementing well-structured referral protocols to help patients navigate through the healthcare system in a timely manner, to facilitate prompt diagnosis and translate to conserved resources and saved lives.
Apart from just developing a structure for more routine breast cancer screening, there have been many innovations to help improve early breast cancer detection. One of the most talked about innovations is machine learning. Using machine learning to diagnose breast cancer can avoid human error and provide faster results. Many different machine learning algorithms have been developed to have a higher accuracy rate for detecting breast cancer, minimizing the risks of false positives or negatives. And these algorithms are only on a path to become more accurate and efficient.
Another such innovation, called the iBreast exam, developed by UE Life Sciences and approved by the FDA, a handheld, battery-operated device that uses sensor technology to differentiate between cancerous tumors and breast tissue. This is done by measuring the differences in the stiffness of the breast, specifically looking for abnormalities. This device is both easy to use and cost-effective, making it an innovative way to increase accessibility to breast cancer screening in developing countries who do not have infrastructure to implement mammograms widely.
Despite the financial, social, and cultural challenges facing early detection, initiatives and innovations are paving the way to make early detection viable. Cheaper, more accessible early detection methods are the next step to decreasing breast cancer mortality worldwide. And we still need to continue. Even small steps such as encouraging friends and family to get regularly screened can progressively make a big difference for the fight against breast cancer.
We would like to thank a few people. Thank you to Dr. Ida for her support through our research. We would also like to thank the Global Health Leaders Conference team for the amazing opportunity, and all of you for listening.
These are some of the resources that we used to prepare this presentation. And if you have any questions about our research or our presentation, feel free to get in contact with us through our email addresses. Thank you.